They said, well, the test is going to be $10,000. And I said, well, then I guess I'm not having the test. I said, I guess I'll go to Mexico.
That's crazy.
And when we came to the United States, my wife said, we need to get insurance. And I said, I've had a poor experience with insurance. They give you the runaround. They don't want to pay. They're really good to charge you.
Right.
They want your money.
Yep.
And I looked at her and I said, I can't do this. This does not make sense. If I don't get sick, I paid a bunch of money, and if I get sick, it's going to cost me even more. I had a health issue, where I went to the doctor and paid the $300 office visit, and he said, well, you need a test. They said, we'll call you later on the price. And I said, well, I don't have insurance. So they called me a day before, and they said, Mr. Pulido, do you have insurance? And I said, no, I don't. I told you guys it was private pay.
Right.
And they said, well, the test is going to be $10,000. And I said, well, then I guess I'm not having the test. I said, I guess I'll go to Mexico.
That's crazy.
And get it cheaper. I said, but here's what I want you to do. Go ask your supervisor or whoever you can how much I can pay private pay, and I'll tell you if I can afford it or not.
Right.
And three hours later, they called me and said, we'll let you have it for $1,500. From $10,000. From $10,000 to $1,500. I was in shock. And I said, all in? Like, that's it? I don't owe you anything? No, that's it. And so I did it. And that's when I told my wife, I said, you know what? This healthcare system is jacked up and broken.
Yes.
I said, look, I can afford the $1,500, but a lot of people can't.
That is true.